Hey, Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you about hyperventilation syndrome. And we just had a situation come up with a patient who experienced hyperventilation in the face of a panic attack. And it was a very uncomfortable situation for the patient due to their anxiety disorder and the panic disorder, the panic attack that they were having. But the symptoms of the air hunger and shortness of breath that the patient experienced related to hyperventilation was extremely frightening for the patient. And I want to talk to you about how to handle that. So, hyperventilation syndrome is where someone breathes too frequently and too much, and they exhale too much carbon dioxide, and there's an imbalance in the amount of carbon dioxide that's in the blood versus the oxygen level. And when the carbon dioxide level actually goes too low, you can end up with what's called hyperventilation syndrome, and you get this feeling of shortness of breath, difficulty breathing, and air hunger. And in that situation, it's very frightening. The patient tends to breathe faster and faster, thus exacerbating or making worse the problem. So maybe you've seen it before, but if someone's having a panic attack, someone will provide them a paper bag, not plastic, paper bag, and they'll roll up the top of the bag and they'll have them breathe in and out of the bag. And by breathing in and out of the paper bag, they're actually breathing back in carbon dioxide that's being exhaled into the bag, and they're breathing it back in, and that brings the carbon dioxide level back towards normal from where they've hyperventilated and driven their carbon dioxide level down in their bloodstream. By breathing into that paper bag, they're breathing in additional carbon dioxide more than normal, and that helps fix the problem very quickly, and it can be a huge relief to the patient. So if you see someone who's experiencing anxiety or has a panic disorder and they're hyperventilating and they're breathing very quickly, very rapidly, and they're having difficulty breathing and they're getting more panicked, certainly you should seek medical attention and get medical attention on the way immediately in case it's not just hyperventilation syndrome or a panic disorder or an anxiety disorder. Get emergency medical care en route to the patient or to yourself as quickly as possible. But in the meantime, grab a paper bag and breathe in and out, inhale and exhale through the paper bag. And by breathing in that additional carbon dioxide, it will help relieve those symptoms very quickly. And that can be really a game changer for these anxiety patients, because when they're having that panic attack and they hyperventilate, the hyperventilation syndrome kicks in, then they start getting air hunger and shortness of breath, and then it just gets into this continuous cascade where they get more anxious, more panicked, they breathe faster, and it just escalates. So have them breathe into the paper bag. You know, if you're out and about, you could grab one from a fast food restaurant that has paper sacks and just roll up the top of the sack and have them hold it down and breathe into that paper sack, thus getting more carbon dioxide in and giving them relief. So I hope that's helpful to you or to someone you know or love, and enjoyed chatting with you about this topic, and look forward to talking to you about similar medical topics in the future. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.